So the International Prospective T-Cell Project 2.0, this is a second version of the International T-Cell Project 1.0. This project was started in 2018 and this is a real-world collection of newly diagnosed peripheral T-cell lymphomas. So we just try to collect data. Now we have more than 120 participating institutes all over the world in all 5 continents. And in Lugano Congress, our abstract was selected for oral presentation on PET-CT features radiomics in peripheral T-cell lymphomas. You know that almost all peripheral T-cell lymphoma, they FDG avid, and we just try to understand how radiomic features can influence to create maybe some kind of PET-guided treatment strategies for patients with peripheral T-cell lymphomas. Also to understand if we will be able with these PET-guided strategies to intensify treatment or to proceed with consolidation with autologous stem cell transplant in the first line. And also there are quite few data, but it already exists, that was published a few years ago by French group, and we decided just to make some kind of validation in our cohort of patients in metabolic tumor and total metabolic tumor volume in peripheral T-cell lymphomas for the patients from Prospective T-Cell Project 2. We took a different cutoff points for evaluating total metabolic tumor volume, and to see how it will work on the 104 patients we selected for the analysis from T-Cell Project 2. And we provided different analysis for cutoff point like 180, 200 and 230, which we took from already existed historical data, and actually 200 and 880 from another study, but not for peripheral T-cell lymphoma, for follicular lymphomas, just to understand how it will work on other pathologies, for different lymphoma subtypes. And in our patients cohort, the cutoff of tumor metabolic volume 200 using SUV 41% like a threshold as a parameter of PET, was more predictable in terms of overall survival and progression-free survival compared to the threshold of SUV4. So patients who had tumor metabolic volume 41% less than 200 had better overall survival rates and progression-free survival rate compared to this one who had more than 200 ml as a parameter of total metabolic tumor metabolic volume of 41%.